I'm Dr. Corey. How are you doing today, Katie? We've had a chance to study the MRI and the CT scan, and we've gotten a pretty detailed look at your blood work.
Doctor, what is your specialty? No offense.
I'm an oncologist.
Oh, no. It was me, wasn't it? I gave it to him, didn't I, doctor? I gave our son cancer.
Okay, that is absolutely not true, Mrs. Harkins. The blood work indicates that you have Lee-Fraumeni syndrome. The syndrome is most often caused by inherited mutations in the gene P53.
Which means what in English?
Well, P53 is the gene that stops the growth of abnormal cells. You have that mutation. You didn't give your son cancer, ma'am. It's an inherited gene that you got from one of your ancestors. Sometimes it skips a generation, sometimes two or three.
So this syndrome is what caused the seizure?
No. People with Lee-Fraumeni syndrome are susceptible to various types of cancer, including brain tumors, which I'm afraid is what you have. It's called glioblastoma multiforme. It is a stage 4 cancer.
Oh my God. Oh my God. What are my chances, doctor? Please don't sugarcoat anything. I'm a big girl. I have decisions to make. I've got to know.
Unfortunately, the prospects are not good. This is a very virulent tumor. It's quite advanced. The tumor is interwoven with the normal brain cells to such an extent that I really wouldn't recommend surgery. There is an experimental protocol that honestly involves chemotherapy, but quite honestly, I don't believe we'd be talking about a cure. We'd be talking about buying you extra time.
How much extra time?
Months, possibly a year.
How much time do I have?
Months. There's a milder form of chemo that we could do. I'm not sure what the benefit would be.
What about this experimental program? Somebody has to have survived this thing.
5%, maybe less.
Then she's going to be part of that 5%. That's all. This is the strongest woman I've ever met in my life. Doctor, she makes miracles happen. Outside of just having had a seizure and being in a hospital, which I hate, I really feel fine. So my question is, how long do I have before I don't feel fine?
Listen, I wish I could give you exact answers, Mrs. Harkin, but I just can't. We certainly have drugs that can keep you comfortable once the pain sets in, if that's what you're thinking about.